Hi, it's Sarah here from Mankyfeet, and right now you're going to watch an ingrown toenail surgery live. This is a real patient who's in chronic pain. He's a chef. His feet are killing him while he's at work, and Dr. Jaws is going to show us how he actually operates and how to remove an ingrown toenail. So if you're suffering from pain, this is what happens when you go into surgery.
A young gentleman who has presented to our office today for the first time with the chief complaint of very, very painful ingrown toenails. The patient is actually a chef. And it is affecting.
Okay, so there's not too much infection actually in this toenail at the moment, but I can see where he's had ongoing problems. So it's definitely a great solution to have a nail avulsion, which is a partial nail avulsion, which is where they remove just a sliver of the side of the toenail. And this is what Dr. Jaws is doing right now. He's preparing the toe, he's cleaned the area, he's lifted, and he's now just slicing away the sliver of nail that's ingrowing, that's causing all the pain and discomfort.
We'll take a nice little slither here all the way back. I personally think that the right is bigger than the left. Yeah.
You can't be squeamish doing this job, and as a patient, if you're a little bit squeamish, I would say don't look while we're dealing with problematic toes, especially when they're ingrown, if there's infection involved. Don't worry about the blood. Toes are really vascular, which means they just bleed a lot.
Para un momento. Está perfecto. Parece que estaba aquí nada más en la esquinita. Look at the right. Okay, so it's definitely in there. Let's see what we got here.
No, I'm good.
Me too.
I just impressed.
Clip. See what we got here. Oh. Ah,
I knew it.
you knew it, right?
I told you.
Probably about 8 out of 10 patients I see who are ringing me up regarding ingrown toenails do have these stealth toenails, which means on a day-to-day basis they're just getting constant pain. They may not always be infected or inflamed or swollen, but they're really aware of the nail touching the side of the skin. If your ingrown toenail is giving you trouble, get the surgery. It cures it and you'll be pain-free. I'd like to thank Dr. Jaws, and I'll put the link below to his video.